Hi everybody, my name is Rachel Richard. I'm an orthopedic physical therapist with postdoctorate studies in pelvic health physical therapy. Thank you for tuning in to our third video today of the pelvic health series. Today we're going to be talking about incontinence, specifically urinary incontinence. Urinary incontinence is the involuntary loss of urine. There are many different types of incontinence, but three main types that we see and that we treat in pelvic floor physical therapy. And those are stress urinary incontinence, urge, and mixed urinary incontinence. Stress urinary incontinence is the involuntary loss of urine with physical exertion, so with laughing, coughing, sneezing, and with exercise. Urge urinary incontinence is the involuntary loss of urine preceded by or accompanied with a large urge to urinate. And then mixed urinary incontinence is a mixture of both stress and urge incontinence together. Both men and women can have urinary incontinence. It's twice more likely in women than it is in men, mostly due to our anatomy. In females, we have much shorter urethras than men do. In women, urinary incontinence is most common during pregnancy and postpartum, during menopause, with aging, and then also during exercise with repetitive jumping, hopping, high impact landings, and with running. In women and men, you can see urinary incontinence with spinal cord injuries, brain injuries, birth defects, multiple sclerosis, and diabetes. And one thing to note is that just because urinary incontinence is common with these conditions does not mean that it's normal. Urinary incontinence is caused by the muscles and or the nerves that hold the urine up inside or that help it pass not working correctly. With pelvic floor PT and with pelvic floor dysfunction, this is when the sphincter muscles that are around the urethra are not strong enough to hold the urine up inside where it should be, or the bladder also may be contracting too much or not when we want it to, because the bladder is a muscle as well. There's also other factors that may also be contributing and that can cause urinary incontinence as well, such as certain medications, chronic constipation, poor breathing techniques and habits during exercise, so like holding your breath when you're lifting or when you're squatting, and also certain toileting techniques that we will talk about later on. So treatment of urinary incontinence in pelvic physical therapy is going to look different for every patient who presents with incontinence. It depends on the type of urinary incontinence that you're presenting with, and it also depends on the findings of the orthopedic exam and the pelvic floor examination as well. There are two main topics that I talk about with all patients who present with any type of incontinence. The first thing is we want to look at your fluid intake. How much are you drinking a day? What are you drinking? Are you drinking anything that is a bladder irritant? Because there are certain fluids that can increase leaking just because they irritate the bladder. The second thing that we make sure to talk to all patients that come to pelvic PT with incontinence are talking about your toileting techniques and your daily bowel and bladder habits. So we look into how many times a day are you going to the bathroom? Do you get up in the middle of the night to urinate? How long is each void lasting? Are you able to empty your bladder? Do you feel like you still have to pee right after you just have? And is there any leaking associated with right after going to the bathroom? Once those two topics of your fluid intake and your bowel and bladder habits are discussed and looked into deeper, then we start to look at treatment from a lifestyle and a behavioral aspect. One thing that we may look at are toileting techniques. We may look at what the patient does when they go to the bathroom. So are you hovering? Are you squatting above the toilet instead of actually sitting down? How long are you giving yourself to go to the bathroom? Are you holding longer than you need to? Are you going too much throughout the day? Are you avoiding going to the bathroom in public spaces? Those are things that we look at and we start to try to change behaviorally. We also may look at bladder retraining, which is a strategy that we can do with patients to set out timed intervals and certain times that the patient may go to the bathroom to help either increase the amount of times that they're going to the bathroom or decrease the amount of times that they're going to the bathroom throughout the day. We also look at your hydration, as we mentioned earlier. If you're not drinking enough water, we try to increase the amount of water that you're drinking a day. And then the last thing that we like to look at are possibly talking about urge strategies for patients. We do this especially with urge incontinence. They are certain techniques that the patient can do to help decrease that urge to have to urinate when they feel it. So they can do some muscle contractions, it's maybe some deep breathing or some meditation, and this helps and allows the patient to be able to make it to the bathroom without leaking. After we have looked deeper into behavioral and lifestyle changes that we can make for treatment of urinary incontinence, the next thing that we like to focus on is the exercise portion. So the treatment and the exercises for urinary incontinence are going to depend on the patient. It's going to be different for everybody. It depends on the type of incontinence you have. It depends on what you're presenting with. So it depends if your muscles are underactive, if they're overactive, or they might not be able to turn on at all. So the first thing that we may look at is decreasing the tone and improving relaxation and lengthening of the pelvic floor muscles. We see this a lot with urge incontinence, so that's something that we would focus on first. Once we have that improved, then we can start focusing on pelvic floor muscle retraining. So strengthening and endurance training, making sure that the muscles can turn on and that the patient can contract them properly. The next thing after we have focused on the strengthening or the contracting and the relaxing and the lengthening of the muscles is to start strengthening the pelvic floor in functional patterns. So working on strengthening the pelvic floor muscle with squatting and lunging. We also will focus on strengthening of the other muscles that assist the pelvic floor in support of our pelvis. So we'll start strengthening our glute muscles, our adductors or our inner thigh muscles, as well as our deep abdominal muscles. And we'll also take a look at the breathing of the patient, their breathing mechanics during exercises to make sure that they're not bearing down or holding their breath, which can also cause leaking during exercise as well. Thank you so much, everybody, for tuning into our third video today of the Pelvic Health series. I hope that you learned something about urinary incontinence. If you are struggling with urinary incontinence or think that you may have it or have been diagnosed with it, feel free to give us a call or reach out on our website to schedule a consultation or an initial examination to see how pelvic PT can be right for you.